Now, শুনা পাইছে?
হয়, শুনা পাইছে।
Hello.
হয়, hello.
Hello. ঠিক আছে স্যার।
Participants, আপোনালোকে সকলোৱে মিউট কৰি ৰাখিব মাইক্ৰোফোনটো, নহলে সাউন্ডটো অলপ ডিস্টার্ব হয়। Hello.
Hello.
Hi. Good afternoon all. Respected Central Executive members of ARPA, speakers and all the participants. On behalf of Association of Registered Pharmacist Assam, commonly known as ARPA, myself Vikas Suikia, welcome all of you to our first webinar on COVID-19, role of pharmacists in prevention of community transmission and panic. Now, let me introduce of our today's speaker. First of all, Dr. Habibur Rahman sir, Principal, Rahman Institute of Pharmaceutical Education and Research, as well as MD of SAS Group. Welcome, sir.
Thank you.
And our next speaker is Maitrayee Dr. Goswami from Clarivate Analytics. She is working in Bangalore as a associate analyst of that Clarivate Analytics. Welcome, ma'am. Okay. Now we'll move to our webinar sessions. I request Dr. Habibur Rahman sir to continue the session.
Thank you. First of all, I would like to thank ARPA, as Association of Registered Pharmacists of Assam, for conducting such a wonderful theme and arranging this webinar during this lockdown period. And there are some topic given to me to discuss. The main things they given to me to introduce about this COVID-19. What is this COVID-19? And during this COVID-19, what things we need to do and what things we need to avoid, and how to prevent the panic among people. So first of all, I would tell you, and most of all are aware about this COVID-19, that it is a viral infection and it is infectious disease. World Health Organization made it pandemic, and it is up to today almost 60 lakhs people around the world are affecting due to this COVID-19. So we should know that this COVID-19 is a viral infectious disease which those symptoms are similar to our common cold and other respiratory illness. One thing. Next thing, we are thinking one total in all over the world due to much use of social media and other panic advertisement, which made that it is almost if any person suffer from COVID, they will going to die. We should know that COVID, this 19 is highly contagious and infectious. Highly contagious and infectious and very, very less lethal. Means it can spread one person to another person very fast. But it is not such lethal that every person mortality is more 100%, 90%, 50% like this. No, very, very less lethal than so many other illness. So that's why we should not be worried. And those person having their immunity, less immunity, they need to take precautions. So I would like to tell that it is infectious disease, highly infectious, highly contagious, but it is not so much lethal. And we no need to be panic. We no need to panic, but we need to be precautious and preventive. We need to take preventive measures. So these things about the COVID-19. Next, what things we need to do, we want to know. Almost everywhere, every persons are aware of these things. What things we need to do during this situation? First thing we need to do, we need to stay clean and hygienic. Very important. Not for this only COVID-19. If we stay clean and hygienic, then almost 90% of illness will not affect us, because cleanliness is very important and hygienic. If we take proper food, hygienic food, then definitely almost 90% of disease will not attack us. Next thing we need to think about our immunity, boost our immunity. We should focus those things which will increase our immunity, and we should not think. Hello. Okay. We think we need to think about how to improve our immunity. Those factors which will increase our immunity. We all know that as a pharmacist, if we take proper diet, if we remain away from stress, and we do physical activity, we not take smoking and alcohol, and then definitely our immunity will increase. And for that we should avoid spicy and some heavy hard food like meat and other things, then our immunity level will increase definitely. And another thing, during this period COVID, we need to maintain some social distancing. That is very important, and this guideline is given by the government also. Social distancing, we should always avoid the public gatherings where more people will gather, and that things we need to avoid. We need to wear the mask and other preventive measures if we go to some public places like this. We need to do these things. And another thing, we need to avoid medicines. We need to avoid medicines unnecessarily. If you need to take any medicine, first need to consult the doctor or a registered pharmacist. I will not tell to go in any pharmacy shop where someone is running a pharmacy. No, you should go to a registered pharmacist, and from there you first consult with them and take, if any minor illness or disease are there, you can take medicines. And unnecessary avoid visit to the hospital, because hospital is nowadays a hot spot for infections. So you don't know who is going and who is visiting the hospital. So first, as a rural area, I will advise to visit a registered pharmacist and discuss with them using your preventive measure and take some medicines for general disease. And without the discussion with consulting with doctor or a pharmacist, don't take any medicines. And another thing you need to avoid is much more stress. Stress is, we know that stress is one of the cause which is decreasing our immunity. Stress will produce the negative thinking, and for that reason, I would like to tell that during this period, we should avoid the much more thinking about this COVID. If we think more thinking always non-stop, If we think about COVID, this many people are affecting, this many cases are there, then what happened? Automatically our mind will full with this information, and which will make us more anxious and more stressful. And due to more stress, we all know that our cortisol level will increase, and our adrenaline, noradrenaline level will increase, which will increase our sympathetic activity, our blood pressure will increase, and finally we will go to a stressful condition, which is not good and which will decrease our immunity. So we need to avoid this stress. And lastly, I would to tell how to prevent panic among citizens. We need to aware the people first thing. We need to aware the people that COVID is an infectious disease. It is not a lethal. It will not cause you death. Simply, it will not cause you death unless if you are not suffering from a severe chronic illness like severe stage diabetes or kidney problem or heart disease. You are not going to die easily with COVID infections. Almost 70% people are having very mild symptoms of whatever the statistics showing, very mild symptoms. So no need to worry at all about this. If it's happened to you also, no need to worry. And we need to isolate, and as it is infectious, we should make ourselves isolated and to prevent the other from this disease. One thing. Next thing, which is causing more panic among people, is use of too much social media like Facebook, WhatsApp, or other social media. Nowadays it seems that every person, one person is suffering from COVID, and that information was sending to 1,000 people through the Facebook and WhatsApp. Recently one incident happened to our locality, Devastan. Some two cases came positive. One small kid of 2-month baby, and one is parent's father. They were in the GMCH, and they are very well and without any symptom, and they are making some TikTok videos also very well. Nothing to worry. But it is made it Devastan is contaminated zone in our locality. So, after 2 days, I got one video message from Mumbai, Maharashtra. People is sending to our WhatsApp that 14 people were died due to the COVID in Devastan. It is a very big rumor. Like this, some rumors and false message are spread through the social media. We need to avoid these things. We need to know the genuine information, and as much as possible, without any requirement, we should avoid the social media, which is making more panic among. Because whatever we know, we are aware people. Most of the peoples are not educated, and they are made afraid and more panic. Their conditions, they are unable to sleep also in the night. If someone is told in your neighbor is a COVID patient, some people are in quarantine also, but some people will give the false information that people's in your near are COVID. Actually, they are in the quarantine. They are not in COVID patient. So like this, some information we need to avoid. And we, as a health professionals, pharmacists, our more important role is to aware the people. Aware the people. And another thing is that nowadays all the news channels and all the other media are making it very highlighting. What is their protocol, we don't know, but as much as possible we need to avoid these things. If we avoid these things, we can prevent the panic, at least from avoiding social media, like we are making social distancing. And next thing is, we need to concentrate on our work. Whatever work, if we are in study, we need to concentrate on study. If we are in any other duty, we need to concentrate on work. If we concentrate on work, then definitely that side will decrease, that whatever side making the panic. We should not do more discussion about the lethality and other infectious cases of COVID. So these are the some things I want to share with you. And finally, I would like to thank Vikas Shaikar to giving me this opportunity to share some information regarding COVID. Thank you.
Thank you, sir. It's a very informative presentation. Now, any participants, any question? If any participants have any question, then you can ask. Okay, then thank you. Thank you, sir, for your valuable
Thank
time.
you.
Now we'll move towards our next session. I'm requesting Maitrayee Dr. Goswami, ma'am, to present her presentation.
Thank you, Vikas, for giving me the opportunity to present here. Can you see my screen?
It's not visible.
Can you see my screen now?
Yes, ma'am. It's visible, ma'am.
Okay. So, hi everyone. I am Maitrayee Dutta Goswami. I'm working as an associate analyst with Clarivate Analytics from past 2 years. So today I'll be talking about role of pharmacists in preventing community transmission and panic among general public. So, what is COVID-19? So as far as we know, COVID-19 is an infectious disease which is caused by severe acute respiratory syndrome coronavirus 2, that is SARS-CoV-2. The spread of COVID-19 began in Wuhan in Hubei province of China in December of 2019. Then the genetics of COVID-19 has been proved to be different from human SARS-CoV and Middle Eastern respiratory syndrome, that is MERS-CoV. Then what do we know till now about COVID-19? The common symptoms of COVID-19 are fever, fatigue, like breathlessness, then loss of taste and smell, etc. While majority of the population might face mild symptoms, some of the patients are facing acute respiratory distress syndrome. The time from exposure to onset of symptoms is generally 5 days, but it may vary in between 2 to 14 days for other patients. Next, how the virus is spreading. The virus is primarily spreading between people during close contact and mostly via small droplets, which may be produced during talking, sneezing, or coughing, etc. The droplets usually fall into the ground or the surface, and then if you touch that surface and then you like touch your mouth or nose, you may be contaminated with COVID-19. Then it has been found that it is most contagious during first 3 days after the onset of symptom, but some people are showing no symptom at all, but yet spreading the infection. Also, it is also possible that you are not showing any symptoms at all, yet you may be spreading the infection to other people. So it is always advised that you stay indoors as long as possible and maintain all the guidelines provided by WHO. The standard method of diagnosis which is used now is real-time reverse transcription polymerase chain reaction, which uses nasopharyngeal swab. Now, next is community transmission. So I read this article a few days back that India must gear to face community transmission of COVID-19. So what is community transmission? Community transmission occurs when a person with no travel history to COVID-19 affected country or he has no history of coming in contact with a person who has been like tested positive for COVID-19, tests positive for COVID-19. That means people who are undiagnosed or people who are asymptomatic are spreading the infection unknowingly. They don't know they have the infection, but yet they are spreading the infection. So it is making very difficult for the government to break the chain of transmission. My next point is what can be done to prevent community transmission. To prevent infection and to like slow the transmission of COVID-19, we can do following. Wash our hands regularly with soap and water, or clean our hands with alcohol-based sanitizer. Then maintain at least 1 meter distance from among ourselves and people who have who are or who we know that they are infected, or people who have a history of traveling to COVID-19 affected areas. Then avoid touching your face and nose. Cover your mouth and nose always when you're sneezing or coughing. Stay at home if you are not feeling well. Then refrain from smoking and other activities which may weaken your lungs, your immunity. Then practice social distancing. That's the most important thing and the most preventive thing we can do right now. That is practicing social distancing. Avoid unnecessary travel, staying away from large gatherings, etc. Now coming to today's topic, that is community pharmacy and its role and how it can help us to prevent COVID-19. So what is a community pharmacy? Community pharmacy is any place under the supervision of a pharmacist where the practice of pharmacy occurs, or like the prescriptions are compounded, dispensed other than a hospital pharmacy or like limited service pharmacy. What are the functions of community pharmacy? The function of community pharmacy is providing health information to patient or public, then prescription handling, patient counseling, patient medication record, pharmacy administration, compounding, etc. Next, I'll be talking about the role we as a pharmacist should play in preventing community transmission. We should always make a list and check all the government websites and local websites for so that we have all the knowledge what is happening around us, and we can anticipate the need that will be needed in our area. Also, we as a pharmacist should never like spread unverified information. Also, always re-verify, recheck the information you get from your teammates or staff or anyone. Then second thing, mandatory temperature check of all our teammates and staff members. And also, if anyone is showing any symptom of respiratory distress, we should advise them to stay at home. Next is practicing social distancing. Like if you run a pharmacy, you should provide a well-ventilated space where people can wait, where people can give you their prescription which they need to fill. All staff and all the patients, all people who are accompanying a patient, they should maintain a distance of 1 meter from one another. Then always promote hygiene. Ensure that your pharmacy has a supply of water and soap, so that if you come in contact with a contaminated surface or a infected person, you can always clean your hands, you can sanitize your hands, etc. Always wear gloves. If you need to touch someone, you know that that person is infected, always wear gloves. Then since if you are sitting in a pharmacy, then obviously you'll be surrounded with lots of people. That means the chance of transmission is very, very high for you. So like stop from touching your face, your nose or anything, and the surfaces where the chance of transmission is very high, like doorknobs, then like tables and chairs, etc. Then frequently disinfect high touchable surfaces, like I told, like doorknobs, then tables, etc. Disinfect those surfaces always with chlorine-based solutions or alcohol-based solutions or appropriate disinfectants listed by the government. Then personal protective equipment. If you are a pharmacist and you need to come in contact with an infected person, or you are observing that in your community the rate of infection is going high and high, so always wear protective personal protective equipments like gloves, masks, then gowns, etc. Also, after wearing those PPE, always dispose them safely in a like non-touchable dustbin, like where you don't have to touch the dustbin, etc. Also, for example, there are tissues which are contaminated with secretions, various type of secretions, respiratory secretions. We should always throw them on a dustbin and dispose the dustbin properly. We should always maintain personal hygiene. Next is preventing panic in the community. So first thing as a pharmacist we should do is educate the public. Pharmacists, as a pharmacist, we are in contact with members of the public, right? So we should give proper information about COVID-19 and how it spread. By doing so, pharmacists can share the knowledge with general public so that they can make a well-informed and healthy decision. Then sharing reliable resources. As we all know, the social media or the webs or the internet is filled with information, videos, and various articles about COVID-19. People are giving various information, homemade remedies, how you can like cure COVID-19, but all those information, they are not always true. We as a pharmacist, we are very highly educated people. We should always give the reliable and most accurate information to our neighbors, to the members of our community, to our parents. And if we are receiving such information, we should stop those. We should tell the person who is sending us this information that this is wrong. The information you are getting is wrong. We should always try to give the general public the most accurate and most reliable information. Then third point is serving as a role model. If you are working in a pharmacy, maybe in a community setting or in a hospital setting, you are coming in contact with like hundreds of people in a day. So if you behave as a role model, if you wash your hands, if you are wearing gloves, if you are maintaining social distancing, then the general people will take this disease seriously. That yes, we need to protect our elderly, we need to maintain social distance, we need to stay indoors, etc. Next is like based on clinical data, animal studies, and clinical trials, 3 drugs are currently under study to be a possible cure for COVID-19. First is remdesivir. It was previously used for Ebola, then hydroxychloroquine and leponavir and ritonavir combination. In conclusion, I would really like to say this, that in India, there are total 173,491 cases and about 4,980 people have already lost their life to this pandemic. Whereas in Assam alone, there are 968 active cases and 4 people have already died. So as a pharmacist, we should always try to uplift social behavior, encourage people to stay indoors, educate them. The most important thing is educating them and preventing the spread of fake news. We must be very patient in this difficult time and encourage people to maintain personal hygiene, stay indoor, maintain social distancing. Thank you, everyone. That's all I had from my side. If you have any question, I would really like to take some questions.
Thank you, ma'am.
Thank you, Vikas.
Thank you, ma'am.
Any questions from anyone, from any participants? If you have any question, then you can ask. Okay, one question from Zakia Akruza. Ma'am, you can see in this group search section. Please check.
I'm checking. I can't see the question.
This one, ma'am. Is hydroxychloroquine is safe for diabetic patient?
Hydroxychloroquine is not safe for any patient because it can cause cardiac diseases. It is just used as prophylactic treatment for everyone as of now. It is currently under study.
Okay, ma'am. Okay, ma'am. Thank you. Any questions from anyone? No? Then okay. Now I would like to thank you, Dr. Habibur Rahman
Thank you,
sir,
everyone.
as well as Maitrayee Dr. Goswami for their valuable time, and thanks to all ARPA members and participants for their support to make it success. Thank you all.
Thank you for
ma'am.
giving me this opportunity. Thank you.
Thank you, ma'am.